Hello, everybody. My name is Borislava Ananieva, and I'm the EPF Youth Strategy and Capacity Building Assistant. Today, I'm very happy to be with you here and discuss this very interesting topic, artificial intelligence in healthcare. Where are we exactly? This is the fifth chapter of our webinar series, which is focusing on digital health. So far, we've discussed everything from the basics up, and I think that this is going to be our last webinar this year. We're really hoping to continue the topic next year as well, and we're sure that there's a lot more to discuss. But let's move in with today's topic. First, I would like to share some housekeeping rules. All attendees are currently muted and cannot share their cameras or audio. If you would like to go to full screen and minimize the control panel, you can do so by clicking the orange arrow that you see on your panel. If you have any questions, even while the presentations are going, please use the chat or questions bar, where one of my colleagues will make sure to answer your questions, and we can afterwards voice them to our speakers today. For now, I think that's it. If you have any technical difficulties as well, feel free to drop them in the chat, and we'll make sure to answer as best as we can. And with this, I'm very happy to give the floor to Michele. Michele is the current EPF policy advisor. He is responsible for leading activities within the digital health thematic area, including the coordination of the EPF internal working group on digital health and developing EPF's engagement with the European Parliament. He is also a member of a number of health policy professional networks, including the Young Forum Gestein Task Force, the Young Coalition for Prevention and Vaccination, and the European Health Parliament Alumni Group. So, Michele, without further ado, the floor is yours.
Thanks, Bori, and hi everyone. Thanks for being here. I will be quite brief this afternoon. I would just want to introduce the discussion with few elements from our recent work on the topic of artificial intelligence, and in particular on our recent survey that we launched 1 month ago on artificial intelligence. I hope that everyone can see the presentation now, but I will start just letting everyone know that, of course, artificial intelligence for us, for EPF, is becoming a quite important topic right now, and we consider it, together with big data, as something that has the potential to transform healthcare in many ways, and have an impact, of course, on patients on many levels, from self-care, prevention and wellness, diagnosis, diagnostics, clinical decision support, and care delivery in the context, of course, of chronic care management. However, as with new technology, there may also be some unrealistic expectation and a set of challenges. If you can go to the next slide. Okay, and the next one as well. All right, yeah, and just to share with you very briefly, we launched, as many of you might know, a survey on artificial intelligence last month to ask about what is the current situation on the topic of artificial intelligence in healthcare, asking some key questions about the knowledge, the use, the most interesting aspects, the main worries concerning the development of solutions, trust, and required level of knowledge and literacy to better engage on this topic. Next slide. The first two elements of our survey are very much focused on the perceived knowledge and the use of AI in healthcare. From the survey, we noticed that the perceived level of knowledge in health of AI in health is still mainly basic, with only a few examples of respondents that say they have good high level of knowledge, especially in particular on risks and applications. Several respondents show that they still do not know how artificial intelligence could apply in health, and this is also the purpose of meetings like this to share a little bit more information, thanks to the nice speakers that we'll have right after. And in terms of use of AI in healthcare, especially for patient and organization, the knowledge about use of AI among the communities is still limited or not present. Next slide. We have also surveyed what are the kind of key things that the patient community is looking forward in terms of artificial intelligence and the key challenges that are still identified. In terms of positive impacts, what was the main actually answer across both patient organization and individual patient is how artificial intelligence is seen as a tool to support healthcare professionals in delivering more personalized care to patients, improve and facilitate self-care, and provide more information to patient and carers, improve quality and efficiency of diagnosis and research and innovation in health, and of course support health system efficiency and delivery of care across sectors. In terms of challenges, of course, as I mentioned, AI, it's quite an interesting topic, but it comes with a series of challenges, as all innovations. And our respondents identified that the mains are the current perceived lack of involvement in the co-design of AI solutions and policies. The lack of transparency on how AI works, including, of course, the quality of data, risk on unauthorized use of AI training data and outputs, risk of incorrect diagnosis and error, and a lack of clarity on liability, so who should respond in case of error, and of course the risk of reduced human interaction with healthcare professionals, which, as I mentioned before, is seen as a really important things that can be improved through AI, but it also is potentially harmed in a way, at least in terms of perception. Going to the next slide, I would like just to pinpoint that there is an overall sufficient level of trust on artificial intelligence, but then again, it's also strongly depending, first of all, on the nature of AI-based decision, so where AI comes into play, and if there's support or suggestion about using AI-powered solution from the healthcare professionals. So then again, it is a trend that came across quite clearly, the importance of AI in collaboration with professionals. On the last point, and this is very much connected to what we're doing today, what knowledge do we need to build? The key responses were easily accessible basic knowledge on how AI works in healthcare, knowing the potential risk and the rights in case of error. This is very important. And knowing how the AI outputs are used, therefore, to make sure that what comes out of the use of AI and the data related to it is safe and protected. Just going to the next slide, these are the main learnings from the survey, and there is clearly a chance now to shape the future of AI in healthcare, because there are many activities that are going to happen at European level, and we'll hear a little bit more about that later. In general, the results of the survey shows that we need trustworthy, ethical, safe, and inclusive artificial intelligence that can support professionals in delivering and the researchers in delivering better care. And to conclude, if you can go to the last slide, we have already, as EPF, started to engage on this. With our response to the white paper on AI, which is based on 9 key steps, and you can check the white paper consultation response to the links that we'll share with you together with the presentation right after. So addressing the key challenges of AI in health that are identified in the survey, the importance of data and unbiased data, especially to not replicate societal bias within AI, the importance of excellence in terms of research, the transparency part, and efficient and use of AI, European coordination, improving skills and digital health literacy, so the knowledge that we mentioned before, the importance of defining risks for AI application in healthcare, and therefore clear assessment mechanism for safe and ethical AI. And at the end, of course, like everything should go together in a framework that is enabled to can enable fit for purpose and, let's say, future-proof AI regulation and AI rules that can be, of course, used by the patient community. As I said, the response is already available, and we will also share in the coming months, weeks, the results refined and finalized of the survey that I just shared with you. And that was my last slide.
Thank you very much, Michele, for sharing this very helpful information. It's very good to see where we're coming from and what is the basic understanding of the patient society for any of this. And with that, it only makes sense to go to our next speaker. Just a second. We're going next to Stefano Stramioli, who is the founder and chair of the Electronic Products and Services of the IEEE, Robotics and Automation Society. He currently is a professor in advanced robotics as well as an ERC Advanced Grant Laureate and member of the Royal Holland Society of Science and Humanities, and a vice president of research at EU Robotics. He is involved in different projects related to control and robotics for medical and inspection applications. Stefano, without further ado, the floor is yours.
Thank you very much. Can you hear me well and see me well?
Yes.
Okay, great. Well, it's a pleasure to be here, and I want to bring you a little bit in the world of robotics, AI and robotics. First of all, just 1 second. I want to start with a statement I like very much. You know, the best way to predict the future is to create it. And I think that, you know, physics predict the future, and eventually robotics will create it for us. But of course, there is a lot of discussion about what is robotics, what is AI. I just want to clarify because there is a lot of misunderstanding in the field. So nowadays, everything is called more or less put under the umbrella of AI. But what you see then clearly on I don't know if you see my pointer. You see my pointer?
Yes,
no?
Yes, we do.
Okay. So what you see here on this side, this is really more robotics. So it's related to motion. Robotics is something where you have an embodiment. So the machine has a body which moves in the physical world. And instead, there are a lot of other applications which are purely virtual, which are only software things. Okay, so this is really the difference, and everything nevertheless is brought under the umbrella of AI. And the importance of robotics is that it makes a lot of results reproducible. You can reach parts, for example, a human body that you couldn't do otherwise, but then very precisely quality of motion, and you can historically measure, for example, certain things in the same place in the future. And of course, you know, we always are inspired as scientists by nature, as Aristotle said, and there is no better thinking nature than actually the human being. And artificial intelligence, of course, is inspired by the intelligence of human being, and that is represented by the brain. But if we actually scale the brain, we scale a human being on the basis of how much volume of the cortex is used to move a certain part of the body, we get the cortical homunculus, which is a very famous puppet in neuroscience. What it shows is that a lot of the cortex is used to move our hands. And that actually is the reason why humans are above any other animals in the kingdom, in an animal kingdom. Because thanks to the fact that we have hands and we can interact with the physical world, we got so intelligent. And so the big challenges are not only, as many people wrongly think, you know, just computational challenges, like, you know, very often AI is profiled with, but also the coupling with using intelligence in the physical world, and that is the field of robotics, is absolutely essential. So in fact, actually, that was already seen in the 80s by a AI scientist from Stanford, who actually said that, you know, it's comparatively easy to play chess or Go, even if we thought it was so difficult, but it's extremely complicated to create machines that can actually move as primitively as a baby who was just born. And actually, we are a number of years forward, and it's still the case. So the real sweet spot is, I think, in the future is what I call physical artificial intelligence, which is on the interface between the more computational side of AI and the physical side of robotics. And here are some examples. We are far from having created machines that can move like these humans that you see on the left, or these little birds which are indicated, which outperform the top planes which are out there. For example, the black bird is a fastest plane, and it goes to 32 body length per second, so its own length per second. And instead, a Swift has a speed of 140 body length per second. And the same you can do it for example, for the roll rates of another plane and another bird. So nature is still far, far ahead of technology at the moment, and especially in the physical world. That's what I'm trying to say. So, excuse me. But there are, of course, a lot of things which robots are better than human, and human are better than. My apologies, it's no corona, but it's only allergic, unfortunately. There are a lot of things in which humans are better than others. So, for example, humans can have a very broad picture of what's going on, and robots are very precise. For example, here's a list which I don't want to fix too much about. One question is also that is often in the mind of people, has been in the media a lot, is what robots are dangerous, or will they take our job in healthcare or whatever. Well, I just want to give you my impression on that, my opinion. I think that's absolutely not the case. So I see a phase one, the near future, we'll say in the coming 30 years, in which all AI and robotics will actually help us in everything we do. But it is actually very important for the future after that to already start thinking about a situation which seems like science fiction, but we will get there, in some years, in which we will have machines that can actually do everything for us. And then if we are in that situation, and we are still alive because we have not destroyed the planet, because if we go on like this, that's probably more likely than this. Then we will have in what I call the second phase. Then you will have marginal cost, economically speaking, going to zero, and the only thing that counts is actually energy and social balance. And therefore, we will have to rethink the way we organize work, the way we organize economy. Because if all the owners of the robots that do all the works and create wealth are in the hands of only few individuals, like this is now the case for Google, for example, in search engine, etc., of course the economic structure will completely create a lot of disbalance with all social consequences for that. The European Commission has been very active in robotics. Already in FP7 invested 4 million euros, and this went on and actually brought in Horizon 2020, which is closing now, the biggest robotics program in the world, the Spark, was a collaboration at PPP together with the private side represented by EU Robotics. As I said, it was presented. I have the pleasure to be the vice president for research of. And thanks to this, a lot of nice things came up, like, for example, DIH Hero, which is the digital innovation hub for healthcare robotics. I want to say a few things about. This is the kickoff in our wonderful TechNet Center in Twente. And the idea of DIH Hero, is in which 17 co-partners are and more than 200 now associated partners are part of, is really to build an integrated and sustainable European system that facilitates and accelerates the application of robotics. So we really want to create and connect all the stakeholders in healthcare in robotics. And how to do that by defining best practices, standards, services. We have innovation brokers that basically help to bring ideas to the patients and to the markets, etc., etc. For example, one of the things is that we have been acting with the support of the European Commission to open calls in which deployment, for example, for disinfection robots were implemented, so that in this crisis attention was given for that. And the next step will be in Horizon Europe, which is coming up starting soon. And as already mentioned, data is the new oil. Actually, data is Google not for nothing is so rich. So big data is the big oil, and that will feed actually two lines. One is what I specifically discriminated talking about algorithm AI, Another one is the systems AI, which is more the robotics. So on the right side, we have what people normally talk about, AI and robotics. And this is the idea to form the new AI PPP. We are now in the current stage to create the private side, and there are unfortunately, some issues to try to find a balance between the various stakeholders. Personally, the way that robotics is in it is that, I like this program very much. If you want to go fast, go alone. If you want to go far, go together. So I think that it's very important that all the three parties in this private side, which will join the European Commission, the PPP level, will be really, understanding that we are there actually at the end of the day for the patients, and in this case, for in this situation. Talking more specifically about healthcare, I want to talk about what's going on in this field. Well, imaging is amazing nowadays. So you have facilities like, imaging modalities in healthcare are amazing. Unfortunately, we use then hands and we lose precisions that is given by these machines. So humans do not speak digitals and robots do. So why don't use the coupling between these machines that provide this incredible data to the fact that we can position very well, etc. Now, one thing, for example, is the issue that we are very active is breast cancer. Breast cancer is the #1 cancer killer in women. And in order to tackle that, we have actually, I want to present it briefly two ways. One was a project that we did with the European Commission, MURAP, and another one is something that we started and actually got very far. And I think we are the top of the world at the moment with this technology. So I want to tell you very briefly these two things. MURAP is actually was a cooperation with KUKA, Siemens, and a lot of hospitals were involved. And University of Twente, for which I'm working, I was coordinating their project. And actually it was very nice. And the idea is basically indicated here. So nowadays for breast cancer, the workflow is very unpleasant for the patient. It gives a lot of uncertainties. And that was exactly what we want to get rid of. So the idea is that in this way, the patient goes directly to the MR, because for very small lesions, you would get a procedure of 45 minutes to get a biopsy from the breast to know whether you have cancer or not. Instead, in this profile, you will just go 10 minutes or 15 minutes in the MR. You will go out and the robot will take over, use the information from the MR to make an ultrasound scans, which will be registered with the MR, and then take a biopsy. And once we have a robot like this, the biopsy can be in one shot right, and possibly in the future, these needles could also have what is called ablation in order to basically cure the cancer on the spot. So my vision is in this respect, and that's why I work in these things, that hopefully soon a woman go to the hospital for a check without knowing to have cancer and gets back home 3 hours later being cured by cancer that she didn't know to have. Another thing is MRI compatible robotics. And one of the things which will disrupt patient care will be intervention radiology, thanks to this coupling exactly of the procedure of the imaging and the robotic side. So, for example, what you see here is a robot that we've built, and I think is the top of the world at the moment, is a robot which is very small and is completely of plastic. So this is Jeroen Velman, a radiologist to which we collaborate, and this is normally what is done in order to puncture the breast. And then we started developing these machines you see coming up, and we started getting a lot of awards for this improvement. And we got now to Sunrun 5, and actually Sunrun 6 is coming out, so we'll be released and show to pretty soon. But as you see, this is actually very precisely guided by the MR, where the lesion is, and then you basically, the patient is on the top, and the robot can very precisely move to the position where the tumors, possible tumors, is seen. And thanks to this robot, which is in plastic, why? Because it can be used within the magnetic resonance. So you can use the precision of the magnetic resonance, but you cannot use a normal robot there. The only thing of metal is the needle, which is titanium, but all the rest is plastic. So it can perfectly function there, and with very high precision, it can target in one shot under MRI guidance the lesion, take a biopsy, and in the future, as I said, possibly ablate the lesion, get out, the patients can go home even being cured by cancer in the future. And also another things in endovascular interventions. This is, for example, a catheter and a guided wire, which is all be driven by our technology, which is all in plastic again. And once again, you can therefore treat the patients for example, for obstruction of an artery or things like that under MR. And the advantage with MR with respect to CT, of course, that you do not have any radiation. Ionizing that irradiation, of course, is much, much better for the patient. So these are very exciting developments, and I think we have a potentials to really change a lot of things in healthcare. So this brings me to my conclusion. So I think robotics will absolutely revolutionize diagnosis and treatment. And I think interventional radiology specifically will take over many of the tasks which are now handled surgically. So, and basically just the coupling with imaging and needles will really help a lot of these patients. You need new tools to exploit the precision and image modalities. And MRI is absolutely one of the best that you have. And once again, I would like to stress for those of you who do not know the field very well, to be very careful what actually AI is. People think they know what AI is, and they always sell it as something which can solve all the problems of the world. But the world we live in is physical. So if you stay in a computer and do only calculation, and you do only algorithm that can interpret images and stuff, and you do not have a coupling with this intelligence to the physical world, well, you reach half of what you can. And with that, I would like to conclude citing another thing I like of Albert Einstein's. I think that especially in robotics, logic will get you from A to B, but imagination will take you everywhere. Thank you very much for your attention.
Thank you very much, Stefano. That was very, very interesting. Just a second. I hope that everybody can now see my screen. Having in mind what Stefano shared with us now, I'm sure that plenty of you have a lot of questions about all the information that we received. Please feel free to drop them in the chat box or in the question box below, and afterwards in the Q&A session, I'm sure that Stefano will be happy to answer any questions you might have. And with this, I would like to move over to our next speaker, Salvatore Scalzo, who is on the line currently. And he is currently a policy and legal officer in the AI unit of DG Connect, working on the new legal framework on AI and AI standardization. Before joining DG Connect, he had a 6-year experience in the medical device unit of DG Grow, where he, just a second, I'm sorry, where he dealt with the negotiations of the new legal framework on medical devices and the medical software dossier. Stefano, Salvatore, I'm going to quickly unmute you, and please, the floor is yours.
Okay, I hope you can hear me.
Yes, we can.
Perfect, fantastic. Thanks a lot, first of all, for the kind invitation. And I'm very pleased to be here. As you know, the Commission, in DG Connect, we are working very much on this topic at the moment. There has been a lot of work in the context also of the COVID crisis with regard to AI and the uses of AI in healthcare. And as you all know, because of course I was asked to speak mostly about how AI is regulated within the EU. We are currently working on a possible new AI framework that would regulate AI in the EU, which will be, of course, the main topic of my presentation. But I wanted also, we can go ahead with the slide. The idea today was really to provide you with a comprehensive view of the work of the Commission in this field, because as you know, when we talk about regulation, of course, we talk about ecosystem of trust within the Commission. So the idea that we would make AI as such trustworthy for people, because we are really convinced that AI uptake in general is very much linked to the AI being trustworthy and reliable. But of course, we have also another important pillar, as I will say soon. Maybe you should continue to push the button, because yeah, there are several. So Of course, this is a more general slide. We recognize, and this is the starting point of our discussion, that AI has fundamental benefits for the society. I think it has been raised also as a general point by the previous speakers, and certainly this is also the starting point for doing work from the Commission side. We want to unlock the benefits that AI has for consumers, has for business, as also for the public sector, and in particular for making public services more efficient and effective. But of course, on the other hand, we know that it creates some risks. It is not true for all kinds of AI, but it is certainly something to be tackled, as I said before, to strengthen the uptake within the EU. It has risks in terms of safety, it has risks for fundamental rights. Next slide, please. So the idea, as I said, is to provide you with a more comprehensive view, because of course every AI is about trust, but is also about building an ecosystem of excellence, because of course AI, it's at the very initial stage of application in many fields, so we need also to let's say incentivize and play an important public role also when it comes to research in the field. And that's why we talk about, you know, this European system of excellence. In terms of Commission's fundamental output and frame for the work on the ecosystem of excellence and the ecosystem of trust for artificial intelligence, certainly the reference point is this white paper on AI, which was published, as you all know, in February 2020. It is a white paper which presents the main ideas of the Commission and which also paved the way to a public consultation which collected actually more than 1,200 responses, which is quite a significant number, and we have analyzed to a large extent. I want also to say that this white paper, because sometimes it's a bit, this is not always indicated when presenting work on AI, the white paper is also accompanied by an important report, especially when we talk about trust and building an ecosystem of trust. The white paper is accompanied by a report on safety and liability for AI, which also makes a comprehensive analysis of the current gaps of the existing legal framework with regard to both safety and liability. And this is, of course, something to be taken into account. So the white paper must be certainly read in combination with this report on safety and liability, also to identify the overall strategy of the Commission. While I will focus on the white paper, we should not also always forget that the digital strategy as such of the Commission foresees also a European strategy for data, to make data more accessible and also more reliable. And data, it is, as it was said by the previous speaker, certainly one of the fundamental key elements also to unlock the AI potential. Next slide, please. So with regard to ecosystem of excellence, I will try to go relatively fast through the main actions that the Commission has foreseen, because I would like really to focus on the regulation and the ecosystem of trust today. And maybe if you just push the button so that also the other points are visible before, thank you. So first of all, we would like, in terms of excellence, we recognize the importance to join forces between the member states and the EU so that investment can be coordinated to the maximum possible extent. And that's why we have a coordinated plan on artificial intelligence, which is set with member states and reviewed on a regular basis. So to make sure that there are no duplications in terms of public investment, but actually there is full coordination to make sure that also large-scale investments can take place and according with a common approach. According to a common approach. Then the second point is about strengthening research and innovation in the field. So through networks of excellence. So this is clearly a key point, as I said before, because we recognize that research in the field must be definitely, let's say, must increase and must receive also the necessary funding from the public sector. Then the idea to strengthen industrial research. So also new partnerships in terms of AI, data, and robotics. The fourth important point is about supporting testing and experimentation through dedicated sites. As you know, you might well be aware from reading the white paper that we also aim, for example, at ensuring that there will be experimenting testing facilities that could focus on certain areas, so that there could be really testing environments for company to test AI under real conditions. So, and this is certainly one of the major things that one of the main elements we're currently working at the moment to set also these dedicated experimentation facilities. Then the idea to help the small and medium enterprises, which could of course play a key role in the context of AI design and development throughout the EU. And here a key role is played, certainly I want to mention this in particular, but this digital innovation hub, so the creation of a network within the EU of digital innovation hubs, one of whose functions is actually also to help SMEs to comply with relevant rules. So of course we see also a possible link between digital innovation hubs for them to play a role also under the new framework and maybe help SMEs in the context of facilitating their compliance and their testing vis-a-vis compliance. The sixth important point is to promote the use of AI in the public sector. In this respect, we foresee sectorial dialogues on the different issues and the different sectors which invest, of course, which are linked to different use cases of AI within the public sector. And the seventh point is about improving skills, so to create really the necessary talents which are also needed in the context of such new and emerging fields. So these are really the seven more important actions and topics, I would say. We'll not go into the detail today for obvious reasons, but these are really the 7 priorities with regard to the ecosystem of excellence. Next slide, please. And now we come to the main topic of today, which is the ecosystem of trust. So how AI could be regulated in the future, and what is the reflection of the Commission in this respect. So the key point of the white paper is, of course, to indicate that the AI has some specificities, which deserve specific regulatory considerations at the EU level to tackle emerging risks. These characteristics are fundamentally the opacity, so the so-called black box effect, the complexity of AI, also in terms of value chain, also not only in terms of complexities as such, design complexity, but also the complexity of the value chain of AI. Its unpredictability and its autonomous behavior, which of course can have a different extent, clearly, so it can be partial or total autonomous behavior. And all this, of course, may make the enforcement of certain rules, the setting and the enforcement of certain rules certainly necessary. So this is a bit the departing point for the Commission's reflection. Next slide. Thank you. I think there is another. Thank you. Perfect. So the idea is a risk-based approach. So we don't consider, we need to reach a reasonable balance. That is a bit our main regulatory objective, to reach a reasonable balance between, on the one hand, tackling the AI risks, on the other hand, not to disrupt innovation in the field. And that requires, in the view of the Commission, a risk-based approach. So we need to, we cannot say that all AI is dangerous. We need to target which AI could be dangerous, which in our view should be very much the exception. And that's why our idea would be, in general, that our future regulatory initiative would target certain high-risk AI systems. And for this high-risk AI system, there should be some mandatory requirements, possibly combined by a ex-ante conformity assessment. In terms of possible requirements, of course, my general caveat today, it goes without saying. We are in the course of reflecting on this issue, so we are still in the course of elaborating our draft. So, of course, the level of information that I can provide today is necessarily limited, and there is a reflection of going together also with a very close analysis of the results of the public consultation that we launched with the white paper. But certainly you are probably familiar with what are indicated as main possible future requirements in the white paper. There is an indication of 5 fundamental categories. So the training data, requirements on data and record keeping, on information to be provided, which is also clearly linked to transparency, a level of transparency of AI. Then we have reference to robustness and accuracy, and finally, to requirements for appropriate human oversight. So this would be, let's say, high-level categories of requirements that we would intend to address for AI risk AI systems in the future regulation. We are also considering, you are well aware from the white paper, the possibility that for AI, which is not high risk, a voluntary labeling scheme could be foreseen. But once again, this would be clearly of a voluntary nature, so it would not be mandatory. Why? I mean, it's something that I already mentioned, but it's worth repeating. Ecosystem of trust means not only addressing risks and uptake, but it also means to create the same set of rules within the EU. So it very much links to the, let's say, to the important argument on building a common market. So to make sure that all the companies within the EU, all the operators, but also all the patients can clearly benefit from the same level of safety and from that legal certainty, which always is a key component to drive investment in a market context. So we think also that setting common rules within the EU certainly would prevent fragmentation of rules, which is damaging to business, and also takes into account the fact that investment on AI needs the good scale in terms of market access. Next slide, please. The public consultation, I already mentioned, we received a really extremely a significant number of responses, more than 1,200, 1,215 to be precise. As you can see, also a very diversified feedback, which included the different types of stakeholders. Next slide. So we have analyzed this to a large extent. We are still in the course of analyzing it, but we can provide you maybe with some numbers, which I hope could be of help also to see more or less what is the feeling among stakeholders about the work that we're trying to do. So as you can see, with regard to the need for a new legislation, let's say that there was a general majority indicating that certainly at the minimum there are gaps and there could be a need for new rules. So as you can see, only 3% the current legislation is fully sufficient, 33% find that the current legislation may have gaps, and 42% say that there is a need for new legislation. So there seems to be a support in general towards the vis-a-vis the reflection that the Commission is conducting, and also the need for some work in the field. And with regard to the high risk, also in that respect, there is a kind of slight, not even too slight, majority of respondents agree with the kind of Commission's approach to target what are high risks with regard to AI. So just limiting the requirements to high risk AI application. Though 31%, they would see also reason to target AI, which is not high risk. In terms of concerns of respondents, I can tell you that more or less they echo what are the first reflections of the Commission as reflected in the white paper. As you can see, I mean, here we just mentioned the first two indications, which is breaching of fundamental rights or discriminatory outcomes. But I can also tell you that there is a very high number of respondents, which is close to these numbers, also echoing the Commission's concern with regards to other possible risks, and notably the ones linked to safety. Next slide. So now, as to the next steps, sorry, yeah, thank you. The next steps, as I said, we are analyzing the public consultation results and preparing an impact assessment, and the next steps, of course, would be to have something adopted by the Commission early in 2021. We don't have a final date at the moment. It should be anyway in Q1. We confirm that as reflecting the Commission's work plan. That would be accompanied certainly by a revised coordinated plan on AI. So a document which is key to the coordination of investments on AI within the EU. So this is the timeline we are working on. Maybe some just the final considerations that might be of interest as we are talking today also about health. Of course, our idea, if you look also at the white paper, would be that our rules on AI would target high risk, but would apply horizontally. And basically, there is an idea that our horizontal framework on AI would complement to the extent necessary and integrate possible sectorial legislation in the field. So we want that basically for high risk AI, our requirements would apply across sectors, because we feel that there is a need for baseline requirements with regard to AI. And as the white paper indicates, also that could be the case, for example, for the medical device sector that, as you know, is currently regulated by the medical device regulation. But the idea would be really not to create duplications or to create additional burdens to consumers, but really to create a full integration between the requirements of our framework and what is already foreseen under sectorial legislation. So we don't want to create additional procedures, but rather to ensure that our requirements would also apply on top of what is foreseen in the context of sectorial legislation. So that is a bit what I can say at the moment, with the caveat that the reflection is clearly still ongoing. I would like to thank you very much for your attention, and I'm happy to reply to questions if there are any. Thank you so much.
Thank you very much, Salvatore. This was extremely helpful. And following that, I think we can move now to the Q&A session. We already received a few questions from the audience, which is very nice to see that there's such an interest in the topic. This one, I think, is for Stefano. Could you please elaborate on how artificial intelligence risks could be mitigated?
Yes, sure. And actually, this is a topic that was discussed. I was invited once to the European Parliament. I gave my view on this. I think that, technically it is possible to mitigate it. It's just, of course, it depends on the kind of applications. But when you build a system, I mean, what is the big problem of AI, which was properly exposed by the previous speaker, is, of course, is the indeterminacy from the results. Normally in engineering systems, you want to be exactly aware of what is going to happen when something happens. And in AI, that's not always the case. So that's why what is called explanatory AI is getting a lot of importance. Nevertheless, you can at a system level build the kind of what are called watchdogs that basically you give a lot of you give a certain freedom to an AI part of your machine, which can make mistakes. But when the action which are taken can be dangerous, for example, or legally discussable, then you will limit the freedom in some sense, and you will take over with a higher level system that will filter what the AI can and cannot do. I'm trying to explain in a non-technical way, but something like this is implementable, and I think is the only way to safely deploy AI kernel in all kind of applications.
Thank you very much, Stefano. I think that brought a bit of clarity to the question. Coming up next, we have a question to Salvatore. Could you please let us know how a patient organization could connect with the EC in the coming months to provide inputs and views on the initiatives, revised plan, and regulatory framework that you've just shared? Is there any consultation we should look forward to or anything else? Salvatore, please, the floor is yours. We can't hear you. I think you are muted. Salvatore, we still can't hear you. I'm not sure if you're... Yep. We could hear you for a second there. Maybe try again.
You can hear me?
Yes.
Now?
Yes,
Yeah.
we can hear you.
Yeah,
Yes,
because
please.
yeah, it's unfortunately it seems that you have to activate my audio every time. Yeah, there was an issue with the connection, but I hope you can hear me. Thank you for the question. I will let you know with regard to the coordinated plan, because as I already indicated, I'm working mostly on the legal framework. For the legal framework, of course, we are now in the course of elaborating the draft as such, but it's a moment where certainly you can send your views to us. That would be absolutely appreciated. And to the extent possible, I mean, we could try also to find a way to discuss maybe on certain technical issues. So if you get in touch, you can get in touch with myself. I will make sure also to involve the relevant colleagues, and we could certainly, we would welcome any views from your side also in a written form, and we could also consider maybe a meeting to discuss certain specific issues. So you can count on our availability in general. Of course, I mean, once again, it's a moment where we're really drafting now. There was a public consultation following the white paper, but we are happy to hear views also at this stage, because it's always helpful for us to see and to understand also what the different parties think about what are the risks for AI and how they should be tackled. So definitely feel free to get in touch with me, and I'll make sure to give the proper follow-up to your request. Yeah.
Okay, thank you. We have another question for you if you want to continue. Salvatore, what are the EC plans in terms of improving skills of both professionals and citizens on artificial intelligence?
Sorry, can you repeat the question? I could not.
Yes, just a second. I'm going to mute you just until I say the question again, and then please unmute yourself again to answer. We have a question. What are the EC plans in terms of improving skills of both professionals and citizens on artificial intelligence? Yeah. Salvatore, you should be able to answer now. Maybe try again.
Hello?
Yes,
Hello.
yes, we can hear you.
Hello. Yeah, I think it was the question about what is the Commission. But I think you will get more information now with regard also to in the context of the coordinated plan. So I will be happy also maybe to discuss this more in detail with the relevant colleagues. The idea would be really for the Commission also to fund, for example, to fund the necessary, in cooperation with member states, also to fund the relevant training activities for professionals in the sector, that is, and also specialized studies in that respect in cooperation with relevant universities. So certainly the idea would be really to develop training activities. That is certainly something I'm aware in that respect. And now we will see, of course, I assume also that there will be more clarity, also more specific details over the next few months in terms of specific actions. But I will also be happy to bring this question back, so you might maybe explore also the details of what we are planning to do. But certainly, this is a bit the core of the activities we would imagine in the field. Thank you.
Okay, perfect. Thank you very much for that clear answer, Salvatore. Next up, we have a question for Stefano again. How do you see, in your experience, the current level of acceptance and knowledge on artificial intelligence among healthcare professionals?
We work a lot with healthcare professionals. So because we in my own group, we have surgeons and radiologists in part-time to make that link very strict. And of course, the people I'm working with, they are very tech oriented because they are involved strictly with us. So in that respect, let's say on the professionals from hospital we collaborate are just, the synergy is just absolutely amazing. Of course, it's not the same everywhere, but I think that it's a question of time, and certainly the new generation of clinicians are born in this era, and so they will accept this more and more. So I am very optimistic about the acceptance and the attitude, I have to say. So I'm very positive about that, absolutely.
Thank you very much, Stefano. We have another question for Salvatore, which is regarding focus on high-risk survey. What was the opinion of the extra 26% of respondents not presented in the slide? Also, how would the identification of high-risk artificial intelligence systems look like, taking the MDR classification in account? Salvatore, please, if you want to answer.
Okay, I hope you can hear me. So
Yes,
the
we can
audio
hear
has been reactivated. Perfect. I think in terms of, but there are a few points I would like to make with regard to this question. So first of all, I assume I cannot provide you with the exact percentage. Of course, 26. I assume, of course, it's split between different positions. So of course the slide reflects what was a bit the two most fundamental views on that matter, and we saw also that there was a kind of also split, and the major split was really with regard to whether to limit the regulatory framework to high risk, or actually also extend beyond the high risk set of AI. But maybe something which could be interesting for you, even more than the percentage as such, is that in terms of criteria for the high risk of AI, you might know that the white paper has basically indicated best possible criteria. Of course, the white paper reflected the preliminary reflection on the side of the Commission, the idea that the risk of the AI would be the result of a combination of sector and use case. Now, I must tell you that the public consultation to a large extent rejected this possibility, or didn't see the combination of these two factors as being really useful to define the risk of an AI system. So we are reflecting now, of course, on different criteria now, because there's, I mean, at least the combination of those two criteria did not convince the stakeholders to a quite large extent. So this is probably a piece of information which might be of interest to you. Now, when we come to the medical device regulation, I mean, there is a lot of reflection ongoing. Of course, we want to make sure that our high risk system can be absolutely compatible with what we have in sectorial legislation. I know very well how the system in medical devices work, and actually we should also, I mean, I cannot say too much, but we should also at this stage, because really there is nothing definite, but the peculiarity with the system in the medical device regulation is that as a result of the new rules, a lot of software is basically almost all software is subject to a third-party conformity assessment. So I think now for us it is important to verify whether let's say all this big category of medical devices should also be subject to the requirements of the AI regulation, or whether we should limit the subset of all this, because of course this is a peculiar aspect for the medical device regulation as a result of the new classification rule 11 in the medical device context, which of course brings up very much the risk category of the relevant medical software. So these are reflections that we are currently, of course, engaging with. So we will also very much welcome your views in that respect. But let me say a final word. It's something that I want to reiterate. Our idea would be that, as also indicated in the white paper, the conformity assessment, we don't want to duplicate the conformity assessment. If there is, in principle, if there is a conformity assessment which works under for a certain sector, or in accordance with certain sectorial legislation, the idea would be not to duplicate such an assessment. That would be actually the key reference conformity assessment, and the requirements for the AI system would be added on top. So that would be a bit, I think, the scheme as reflected in the white paper, which we could prefer, because it would minimize the complexity and the bureaucracy for for operators, while of course guaranteeing a full link with the sectorial legislation and also the proper application of our future rules to the different concerned AI systems. So this is what I can say. I hope it was clear, but I welcome also if there is a follow-up question on this, happy to reply.
Thank you very much, Salvatore. I want to use this opportunity to also say that we still have some time for a few more questions. So anybody from the audience that would like to ask more questions to Stefano, Salvatore, or Michele, please feel free to do so in the chat box or the question box. The next question that we have is again to Stefano. Regarding the specific solution you have presented, could you tell us how and if it addressed the challenges presented in EPF survey? For example, was the solution co-designed? Can the system make a mistake? And if so, who would be liable for this? Which were the measures put in place? Okay, if you want to answer this, and then there's a bit of a follow-up.
Yeah, sure. No, it really depends. I mean, the solution I was talking about is a technical solution. And of course, how to embed it in a liability issue or legal issues, that's a different story. I think that first the legislation, I think that Salvatore could much better answer that, is of course it depends of what the liability is a very, very complicated issue, even outside AI and everything which is technologically developed on technology. Let me give you an example which is used all the time. If you have a car which is autonomous, and you know, this is a typical example in AI, and at a certain point, due to the circumstances, basically there is no other solution than three options: that you, with the car, you crash and you die yourself, that you go, the car goes right and kills a little baby which is walking on the street, so to speak, or an old lady on the other side. The question is you know, as a user, you should be able to make that choice, because technology will exactly do what you say. Okay, so the question is how you embed it in the liability and the responsibility the user take. So if you as a human are in the situation I just sketched in a normal car, you know, you don't even know what action you take. If you take a certain action, maybe impulsively or maybe consciously, so it's random sometimes, maybe, but a computer and does what you tell him. So what I'm trying to say is there are different things to look at. I think that ethical issues are very important. So on the basis of ethics, you should define what a machine is allowed or not to do. And then liability, of course, cannot be given to a machine. So you have to think in this extreme, this very complicated matter, which is outside my expertise. But I think that you can at least use technology, and my expertise I was talking about, by actually following those rules that you have decided at the ethical and the legal level. I hope I answered the question.
I think so. Thank you for the clear answer. The continuation of this question was, which were the measures put in place to ensure the transparency of the decision-making process?
Well, yeah, that is the biggest problem in AI. Look, once again, you know, when people talk AI, a lot of people don't even very clear what it is. But what very often people think about AI, they talk about AI, is what is called deep learning. And it is basically that, you know, you learn a computer, a network, to do certain things when you give it certain data. And then when this is learned and is used by itself, you know, very likely is going to take the same things if you give it and you feed exactly the same data. But the whole point is, of course, that you want that the machine is able to handle data which are not fed when you have learned it. And in those cases, you actually don't know what the machine is going to give you as an answer. So it's very complicated. So you need outside, you basically need a kind of how do you say, a policeman, if you wish, what is called a watchdog, which then balance the output that this machine has been given in order to take the right decision. And of course, a big point of research is explainable AI, so that you are able to understand what is learned in the learning phase, so you can predict how the algorithm is going to behave in case you feed it with data which is different than the data you trained it with. Okay, so it's an ongoing, absolutely fundamental research for this.
Okay, thank you very much for the explanation. I think that was very informative. Having in mind everything that we just heard from the presentations and from the Q&A session, I would like to head over to Michele for some just final remarks for this webinar and on this topic. And then afterwards, if there's no more questions from the audience, I think that would be it. Michele, the floor is yours.
Yes, thanks, Borislava, and thanks to speakers. I think we learned a lot this afternoon, and it is a topic that it's highly of interest for us, and as presented by Salvatore, it's going to be very high in the European agenda. So both for organizations like EPF, but also for organization at national level, it's going to be definitely interesting for us to engage on this in the coming months. So you know, rest assured that the Patients Forum will do the best to represent our views, as we've done already with the white paper consultation, and also building knowledge and evidence around the current situation with patients and artificial intelligence to the survey. And we hope to even work even more in the coming months with our digital health working group and with all interested people. So to the audience, to our members, if you want to know more, please do not hesitate also to contact us, and me in particular, as I'm following digital health mainly. With any follow-up question that we might, you know, share with the two speakers, or include in our work on the topic. Once again, it's going to be a very important topic for us. I really hope that you enjoyed this capacity building webinar as much as I did. I think it was extremely informative, both on the side of let's say the scientific aspects behind the AI and robotics, but also from the point of view of what's going to happen in terms of legislations. And thank you everyone for joining today, and I will give the floor back to Borislava to close the webinar.
Thank you, Michele, so much for this. We're receiving some very nice comments. Thank you, everybody, with congratulations for the wonderful and informative presentations. I want to also thank everybody who participated in today's webinar. This is going to be the final edition of our webinar series focusing on digital health for this year. Hopefully next year we will continue the topic, as it had such great interest from our membership. Thank you again to the speakers and mainly to the audience for being here and wanting to learn more about this topic. I want to inform you that all of the people who were registered for the webinar are going to receive a follow-up email with all the information, the recording from this webinar, which you can share, of course, with your peers, but not outside of your organizations. As well as the presentations of our lovely speakers today, if they would be happy to share them with you, of course. And I think that's it for now. Thank you for this wonderful series, and we'll see you again soon with more exciting content on these topics. Goodbye and have a nice day.